Welcome to our webinar, The Extreme Risks of Heat and Those Who Are Impacted. Before we begin, all of us at the Medical Society Consortium on Climate and Health respectfully acknowledge that our advocacy, education, and learning across the country takes place on the occupied and unceded lands of many Native American tribes. To acknowledge this land is to recognize its long history and our place in that history. It is to recognize these lands and waters and their significance for the peoples who lived and continue to live in this country, and those whose practices and spiritualities were, are, and shall always be tied to the land and the water. Today's webinar is the second in our 2023 Climate Justice webinar series as part of the Climate and Health Equity Fellowship Program. The CHEF program recognizes the need for more diversity in climate and health leadership and a sharper focus on equitable climate solutions. The goal of the fellowship is to empower doctors of color from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity, education, advocacy, and policy solutions. I am Dr. Kimberly Williams, the Fellowship Program Manager. Also joining me from the consortium to run this webinar, our Program Manager, Jordan Curry-Carter, and our Digital Communications and Multimedia Program Assistant, Clarissa Payton. They will be available through the chat to answer any technical questions during the webinar. Our other team members on the webinar are Dr. Venice Curry and Dr. Mark Mitchell. The webinar series is hosted by the Medical Society Consortium on Climate and Health and is held for 1 hour on the second Friday of each month from 3 to 4 p.m. Eastern. Today's webinar will be recorded and made available on our website for future viewing as part of the Equity Resources page on the consortium's website. This year, we are pleased to offer CME credit for our webinars. Instructions on obtaining credit will be provided at the end of the webinar. Today, we are honored to have Dr. Marshall Shepherd, Director of the Atmospheric Sciences Program and Distinguished Professor of Geography and Atmospheric Sciences at the University of Georgia, and Jeannie Economos, Pesticide and Safety Environmental Health Project Coordinator at the Farm Workers Association of Florida. The description of their impressive work can be found in their bios, which are now being placed in the chat. According to the CDC, over 600 people die due to extreme heat-related factors, and thousands more are severely impacted every year. In this webinar, Dr. Marshall Shepherd and Jeannie Economos will discuss which populations are most at risk, including farm workers or those who live in urban heat islands, what factors contribute to these impacts, such as the intersection of urbanization, heat, and health, and what can be done to mitigate and address these effects. The general format for today's webinar will be 2 20-minute presentations by our speakers, followed by 10 minutes of question and answers from you, our audience. We ask that you put comments, links to any resources that you may recommend, or any questions that you may have for our presenters in the chat box at any time during this presentation. We will get to as many of the questions as we can during the Q&A period. Please remain muted so that we're not interrupted by any background noise. Dr. Shepherd, are you with us? Okay.
No.
We will get.
No, he's not.
Okay, thank you. We will get started with Jeannie Economos. And for Jeannie's presentation, she will be off camera so that we are focused and centered around the farm workers who she will describe for us today and their struggles. You may begin, Jeannie.
Thank you very much. And thank you very much for inviting me to this opportunity today to share our work with farm workers and the reality that farm workers face in confronting climate change. Farm workers are the people who harvest the food that we eat, and they are people that live in rural communities. And we've been working with farm workers for 40 years at our organization, the Farm Worker Association of Florida, and I've been working there for about 25 years. Next slide, please. And I just want to confirm that I have no financial or other relationships to disclose. I work for a nonprofit grassroots farm worker organization based in Florida with 5 offices in the state. Next slide, please. So who are farm workers? They're often the invisible people behind our food system. During COVID, they were called essential workers. Ironically, farm workers have been essential workers ever since they've been doing the work of farm work in our country, because they harvest the food that the rest of us depend on. In the United States today, most farm workers are Black and brown people of color. The reality is that the first farm workers, quote unquote, were actually enslaved people from Africa working on plantations in the Southeast who were doing the work that fed the entire country. Today, the demographics have changed and they're largely Hispanic and Haitian in Florida, including some African-American or Black farm workers that are still in farm work. They work for low poverty wages. Most of them have little formal education, though they can be very knowledgeable and skilled. Today, most of the farm workers have limited or no English language proficiency. And they're subject to harassment, intimidation, discrimination, and exploitation in the workplace because they're mostly minorities and because they come from low socioeconomic backgrounds. Unfortunately, that makes them vulnerable to intimidation and exploitation. Labor trafficking is a big issue for some farm workers, and that we have many stories of victims of labor trafficking in Florida. They often have limited or no access to childcare, which makes it very difficult for their children. They do not get any workplace benefits, and the majority of them do not get any kind of worker provided or employer provided health care. They live in marginalized rural communities, and today the majority of farm workers are undocumented. Next slide. And in Florida, we just had a horrible anti-immigrant bill that was signed by the governor this past week. So what are the realities of the living and working conditions of farm workers? Well, they work in extreme heat. They can be in extreme cold conditions. They can be victims of natural disasters and storms. So they work throughout harsh weather. They're exposed to toxic chemicals and pesticides, which can have both acute and chronic health effects that I could talk for hours about, but I won't, but just ask me. They're also exposed to insect bites, snakes in the fields and the orchards and the groves, fires, both in Florida, but also on the West Coast as well, and dangerous farm equipment. Accidents with farm equipment is one of the leading causes of injury and death of farm workers in the United States. They work long days with very few breaks. They're often paid by piece rate rather than paid by the hour. So they're paid by how much they produce, which incentivizes them to continue to work without stopping to drink water or go to the bathroom. And too oftenly, they don't have either bathrooms or drinking water in the field, or the drinking water and the bathrooms are far away, which means they would have to stop work and walk to get to the bathrooms or to get water. And often they don't want to do that because that means less production. Their living conditions are often substandard. They live in inadequate housing. They often live in remote rural areas where they don't have access to services or networks that can help them. Sometimes in like Central Florida, where it's less rural now, you'll find multiple families in a household, especially since there's a big problem with low-income housing. Some of the guest workers or H2A workers live in barrack-like conditions, barracks or hotels that are in remote rural areas where they don't have access to services. They're often in flood-prone areas, and they generally lack transportation, especially if they're guest workers from other countries. So they have to depend on somebody else for transportation. In Florida, they can't get a driver's license. So if they're undocumented, so that makes it more difficult as well. Next slide, please. So farm workers do some of the most important work in our country. They feed America. Their backbreaking work is what feeds the rest of us. And yet they are victims of what's called agricultural exceptionalism. And that is the fact that in the 1930s, when the New Deal labor laws were enacted, the farm workers and domestic workers were deliberately and intentionally excluded from laws that covered almost all other workers. So for example, the National Labor Relations Act excluded farm workers from the right to form unions and to collectively bargain. The Fair Labor Standards said that all workers had to have a minimum wage, overtime pay, workers' comp, and there were child labor laws. Farm workers were excluded from that. In Florida, we do now have workers' comp for farm workers, but the point is that this was a deliberate exclusion of farm workers from these laws. They were also excluded from most of the safety regulations under OSHA. They are covered under what's called the General Duty Clause, which basically just says that employers are not supposed to harm their workers. The next slide, please. So this is called agricultural exceptionalism. And it's really important to understand that this was done deliberately at the behest of the legacy of slavery, the agricultural industry and big growers, including the ancestors of plantation owners, lobbied Congress to exclude farm workers and domestic workers from these labor laws. So the problem is deep systemic and institutional racism within our very system of agriculture. And farm workers in the United States today, even though slavery ended in 1865, we still have a form of modern day slavery in many cases in agriculture. And farm workers today are living the legacy of slavery in the United States. In 1973, the term environmental racism was coined, and it was the beginning of the environmental justice movement. Farm workers are an environmental justice community. They're not like a regular environmental justice community because they're not place-based. Farm workers are all over the country, but one of the things that they have in common is their exposure to toxic agricultural chemicals, including pesticides and other workplace conditions, and also their exposure to extreme heat without any protections. Next slide, please. So the farm worker reality. There are approximately 500,000 farm workers under the age of 18 in the United States working today. And right now, I was on a call yesterday that number seems to be going up because of what's happening with inflation and immigration in this country. The majority of working children in the United States work in agriculture. So 70% of the working children in the United States are children that work in agriculture. Women are an increasingly large part of the agricultural workforce in the United States. In Florida, the percentage is even higher because we have lots of nurseries that grow ornamental plants and tree farms where a lot of women are working. Today, many are climate refugees from Central America, mostly Honduras, Guatemala, El Salvador, increasing numbers from Nicaragua, but also from Mexico and from the Caribbean, including Haiti. Many of them are climate refugees because of hurricanes that have hit Central and South America in the last few years. And also they're escaping violence and economic instability in their home countries. You can see in the picture at the right, the way the woman is dressed. She's working in what's called a fernery. So you can see that she's bending down. She bends down all day long to cut ferns. Next time you go to the store and buy a flower arrangement, you will see ferns in your flower arrangement. They probably came from Central Florida because it's considered the fern capital of the world. You can see how she's dressed. It's a sunny day, and yet she's wearing a long sleeve shirt, hat, gloves, long pants, and other protective clothing. The farm workers wear layers to protect themselves from pesticide exposure, from insect bites, and from sun so they don't get sunburn. But you can also realize it's hot out there. So she is wearing all this protective equipment, and yet that also increases her body temperature. In her case, she's also wearing a black plastic bag around her body. And that black plastic bag is to keep the water off because ferns grow in a very moist environment and the dampness can get on their clothes. So we're very concerned because EPA is considering increasing PPE for farm workers based on certain kinds of pesticides. Next slide. So the Farm Worker Association has been very concerned about heat and the intersection of environmental racism, heat exposure, and climate justice or climate injustice. So why is heat a problem? Well, heat is one of the largest weather-related killers in the United States in the past 30 years. Outdoor workers are especially at risk. Body temperature rises with outside temperature, but core body temperature rises with exertion. And as you saw in the previous picture, the woman harvesting the ferns was bending down all day long. So she had increased exertional heat. Heat exhaustion from heat exposure and loss of fluids and salts, such as due to sweating, can cause heat exhaustion, heat stress, and even heat stroke. Pesticide applicators and handlers are especially at risk. You can see the picture on the right. The gentleman is wearing a full suit to protect himself from the pesticides, and yet he's in the hot sun, in the heat, spraying a toxic chemical. So that compounds his risk. And one of the things that we're very concerned about, and that hasn't been studied very well yet, but we're hoping that there will be more studies, is what is the compounding effect of being exposed to heat and pesticides at the same time? Do the two exacerbate each other? And the initial few studies that are out there are showing that yes, there are compounding effects of being exposed to both heat and pesticides at the same time. Next slide, please. So the Farm Worker Association has been doing community-based participatory research with Emory University for close to 10 years. We only engage in participatory research with academic institutions when we have an agreement that the community partner is just as important and just has as much knowledge and skills and it gets as much respect as the academic institution that we work with, and that there is some benefit back to the farm workers, that it's not just research for research's sake. So we've been doing a project called Los Girasoles, which is a heat stress project. We've been doing that for about 6 years now. And we looked at the activities, the positions, the environment, and the duration of work of the farm workers that we work with. And you can see the picture on the right of the gentleman that's harvesting oranges. Just very quickly, one sack of oranges that the man is holding there can weigh as much as 80 pounds. And today in Florida, farm workers make about 80 cents for an 80-pound bag of oranges that they harvest. Next slide, please. So this is going to talk a little bit about the project that we did with Emory University. What we were looking at is the effects of heat on the body, and the heat can affect both the brain, the heart, and the kidneys. In terms of the brain, it can lead to lower concentration, poor memory, and headache. And if you have lower concentration and you're in a tree harvesting oranges, that can mean that you're at greater risk for falling down. It can affect the heart, which includes dizziness, fainting, fatigue, low blood pressure, and heart attack. Also at risk for doing this dangerous work. Those things could exacerbate your incident for accidents. And then kidney dysfunction. And that is both chronic and acute kidney dysfunction. Next slide, please. So how did we do this study? Well, it was really great. At the time we began, we used some really, I think today the equipment that we used it's much more well-known, but at the time it was really kind of state of the art. So we studied over 250 farm workers in 5 different areas of the state. And they would come in on a Sunday before work, and they would spend about an hour or 2 at our office, and we would do baseline measurements, including weight, height, but also blood pressure, finger stick, blood test, etc. And we would do a baseline survey. Then on Monday morning before work, they would come into work and get fitted with the equipment that they would wear all day long, come back after work, take the equipment out, off, download the measurements, and they would do that for 3 days in a row. And on the last day, they would do an exit survey. So what did we measure? One of the things that we did when they would come in on Monday morning before work on the first day, they would swallow a pill. Then they would wear this monitor that you can see on the right on their body. And the pill would send signals every 30 seconds during the day to this monitor to measure their core body temperature, which was really great. So they did that for 3 days in a row. Next slide. And they would also wear, on the right, you can see an actigraph, and that would measure their movements, like bending over and reaching, etc. And that data would also be captured in a monitor there. And then they would also wear a heart monitor that you can see on the right-hand side. And all this data was collected and put into a red cap. So it was measured every day so that we can download these measures into a red cap. And the data collection was really extensive to do the data analysis because there were so many data points. Next slide, please. And so that was looking at their measurements during the day, exertion, heat, core body temperature, and the activity. But we also looked at home and work environments. They would wear a heat button at work to measure the kind of the ambient temperature in where they were working. And then they would be given a thermometer to take home to see if their home temperature was cool enough so that they could adequately cool down in the evenings before going to work the next day. We also did urine samples to look for dehydration, and we took blood samples to look for kidney function. And again, we did this every morning before work and every day after work to compare the measurements. Next slide, please. And so what were the results? This is a very quick overview of a project that lasted quite a long time. And after quite a bit of data analysis, this was a summary of the results. So of the people that we studied, 53% of the farm workers who came to our office were dehydrated before they even went to work. 81% were dehydrated after work. You can see that only 10% maintained a normal body temperature throughout the day. 90% of participants exceeded the heat stress limit of 100 degrees, 100.4 degrees Fahrenheit on at least one day, which is equivalent to having a mild fever for at least part of a day, every day while you're working, and what the effects of that can be on the body. You can see that 42% developed at least 3 or more symptoms of heat-related illness. And the pictures there don't show all the symptoms, but it includes excessive sweating, headache, nausea, and vomiting. Headache was one of the most common symptoms that almost everyone said that they had experienced. So that could be from both pesticide exposure and heat. And then you can also see that 36% developed acute kidney injury on at least one day of the 3 days that we studied them. Next slide, please. So what does this mean? Without intervention, excessive heat exposure can lead to heat stroke, or it can also lead to other heat illnesses that can cause permanent organ damage or death. One of the things that we went into the study to look at was the effects on the kidneys of chronic dehydration. Next slide, please. And so what does all of this mean? Well, again, we did these studies with the goal in mind of not just doing the research, but also helping farm workers to protect themselves. So OSHA has guidelines or guidance, but they don't have any regulations. So we would give farm workers at the end of the 3 days, or actually 4 days, we would give them information about diet and how to work better and what things they could do throughout the day. But we would tell them to drink water throughout the day, to use cooling towels, to take rest breaks in the shade, and wear loose breathable clothing. The reality is that's a lot easier said than done, because the workplace conditions often don't give you the opportunity to do that. You often can't take breaks because your supervisor will tell you to keep working. You often cannot stop to drink. We have had farm workers tell us that they wear diapers to work because they don't want to have to stop to go to the bathroom, either because their supervisor won't let them, or because they will be able to stop working and not be able to increase their production. And so they work right through their breaks, so they don't have to, so they can continue to make money. Next slide, please. So what does all of this mean? So again, we didn't just do this study just to get research. We developed, tested, and implemented a heat stress training for farm workers, and we're currently doing those trainings for farm workers in the state. We actually have 3 trainings, and they're excellent. One training just looks at how about the very general things about how to protect yourself from heat exposure and what the signs and symptoms are. One of the other trainings is a little bit more specific that talks about our research. But the third training is very deep, and it really talks about the kidneys and how the kidneys can affect your whole body if you're not just having kidney damage. So we do these trainings with farm workers. We also developed educational videos and materials for workers about recognizing the symptoms. We're also part of a social marketing research project that was kind of a pilot project that worked with one employer to see if piece rate versus working by the hour and versus giving workers a break wouldn't actually protect workers, but also help them increase production in the long run. We also looked at the key role that healthcare providers play in identifying, diagnosing, treating, and preventing heat-related illness in patients. And what's really important, and we have been talking about this for many years, is the importance of taking an environmental and occupational health history, because oftentimes the symptoms of both heat exposure and pesticide exposure are very similar to the flu or a cold or even a hangover or other kinds of health related illnesses. And so oftentimes the symptoms are overlooked, or they're just treating the symptoms and not looking at the root cause, which could be occupationally related. So that's why it's important to educate our healthcare providers as well. We work with partners and allies locally, statewide, and nationally to create and share resources and research and to develop new projects, which we also have some new projects that we're working on. The military has money for monitoring their, the military has heat stress protections for soldiers in the military, and yet farm workers and outdoor workers do not. And this is something that we have been trying to address. And we'll go to the next slide and we can talk about how we've been doing that. So for 4 years, skipping 1 year during the pandemic, we've been trying in Florida to get a heat stress prevention policy passed through the state legislature. Unfortunately, this year, the 4th time we've tried, again, it failed in the state legislature. We thought it was going to get heard in committee, and at the last minute, it didn't. But we're one of the hottest states in the entire country, and yet we do not have heat stress protections for farm workers and other outdoor workers. This is something that needs to be corrected. We also are working on the national level. There's a bill, I think it still has to be reintroduced with this Congress. It's called the Asunción Valdivia Heat Illness and Fatality Prevention Act. And that bill is to get OSHA to promulgate heat stress protection regulations nationwide. So we're supporting the bill, but also at the same time under, I think about a little over a year ago, OSHA did open up a comment period, and they are starting a process to develop heat regulations. We submitted comments to OSHA on several different occasions. However, because the bureaucracy takes so long, it could be anywhere from 6 to 8 years before OSHA actually has regulations in place to protect workers from heat stress. In the meantime, workers are at risk. And as we know, not only is the temperature getting more intense, but also so are natural disasters and storms, which put all outdoor workers at risk. I could go on, but we'll finish here with, I want to thank everybody for this opportunity. We're a statewide organization with about 10,000 Haitian, Hispanic, and African-American members and 5 offices in the state. And I'm very, very happy to take any questions. So thank you very much for this opportunity. Thank you.
And Jeannie, thank you for that extremely informative presentation. We look forward to asking questions at the end of our time together today. We do have Dr. Marshall Shepherd, who has joined us Dr. Shepherd will share with us information around the intersection of urbanization, heat, and health. Dr. Shepherd, I will turn it over to you.
Thank you, Kimberly, and thank you for the call. I apologize for jumping on at this time. I was in a tunnel vision state where I was working on something else and just got immersed in that, and Kimberly had to ping me. But actually, listening to my colleague there in that previous talk, I think is a perfect segue. So I want to sort of pull back and give you a little bit of understanding of sort of what I call the extreme weather climate gap and these intersections of extremes, vulnerability, and risk, particularly as it relates to urban populations, but not exclusively urban populations. If you are on Twitter, I invite you to follow me on Twitter at Dr. Shepherd 2013. I share that because I tweet a lot of information about weather and climate and other science topics as well. And you can see all of my credentials there. So again, we're pulling back here. I'm a climate scientist, and I wanted to share with you this figure. This is the number of 2022 weather and climate disasters in the United States last year that produced at least $1 billion in damage. Now, that's a damage standpoint. These metrics issued by NOAA really don't account for things like health outcomes, health disparities, and so forth, but it gives you a sense of the number of extreme weather events and the scale of them that we're dealing with in any given year. And this number just continues to increase based on data and statistics from NOAA. We're talking about heat. I wanted to start right here. In 2021, the Pacific Northwest of the United States experienced an unprecedented heat wave. What made this particular heat wave even more taxing from a health disparities and health outcomes perspective is that many of the houses and infrastructure in that part of the country don't have any air conditioning or very limited infrastructure to support mitigation and adaptation to this type of heat. We just didn't expect this type of heat in places like Portland, Oregon, and Seattle, Washington. And in fact, a study was recently published in the peer-reviewed literature that suggests that the magnitude of that heat wave was 150 times more likely because of climate change. Again, we get heat waves. We will always have heat waves naturally, but what we're seeing, and you'll see this in a moment in something I show you, is the extremes are well beyond the extremes that we anticipated over the past several decades. We're just in a new regime, and this particular heat wave is a 1 in 150,000 year event, and that's a probabilistic metric. It can certainly happen many times in a given year, actually, or a couple of times. So I'm not going to spend much time on this slide because it's just the slide that I feel like I have to show in every talk. Our climate is changing. We have to get beyond the notion of saying is going to change or will be like this in the future. It's here. We're seeing it in our heat waves, our floods, our hurricanes, drought, and so forth. The reasons why are related to greenhouse gases. But I want you to watch this graphic. I used to be a scientist at NASA before joining the faculty at the University of Georgia. And so this is a graphic that NASA Goddard Space Flight Center, where I used to work, it was generated. And it shows you the changes in temperature over the last several decades. And I'm going to let it play a couple of times because I want you to, I know this is a medical community and the audience is thinking about this from a medical standpoint. I want you to sort of look at a few things. So an extreme event in 1950, an extreme heat wave, is now, if you see this shift, almost a normal event. In other words, what was considered extreme in the 1950s has almost shifted to being a normal event in the center of that Gaussian distribution. So that means today's extremes are well beyond the extremes of the 1950s. But here's another thing that I want to point out from a standpoint of health outcomes and health disparities. Watch what happens to the left side of this graphic. One of the things that we know is the minimum temperatures are also warming. This means when we have heat waves in the Pacific Northwest or in Europe or in Chicago or Atlanta, temperatures aren't cooling down as much at night. And so that is what we know from a physical public health standpoint can be a stressor for health outcomes. The fact that our minimum temperatures, these temperatures on the left, are also becoming warmer. You can see that this shift is sliding to the right in all regards. So, I mean, it's basic physics. I'm not going to go into a physics lesson here, but yes, our climate changes naturally. I get that all of the time. We do have a naturally varying climate system, but we have a human steroid on top of it now. So it's not an either or proposition. It's an and proposition. We can have a naturally varying climate with a human steroid causing climate on top change on top of it, in the same way that grass grows naturally in our yard. But if we fertilize it, it grows differently. It's an and proposition. And so the increase of human enhanced greenhouse effect is really driving this warming. But again, the warming is just one aspect of climate change. I mean, it leads to changes in sea level, intense hurricanes, flooding, drought, and so forth. But focusing primarily on the heat for this discussion today. And this ties in exactly to what the previous speaker was just talking about. This is a graphic that I like to show from the National Climate Assessment Report. It's a report that the US government issues every 4 to 5 years by congressional mandate, by the way. And it shows you the changes in work hours expected in different parts of the country as a function of changing heat and some of those OSHA regulations and so forth. And so you can see in the parts of the country that I live in, anywhere from 4 to 6 hours of reduction of work hours because of just more extreme heat by the end of the century. So these are so what issues to populations and households. It's not about some polar bear. This is about working in those agricultural fields or in the construction industry and so forth. So many of you may be familiar with Jonathan Patz and some of his work. This is adapted from the CDC. This is just a laundry list, if you will, of the impacts of climate change on human health and the exacerbation of existing inequities. And so we're focusing primarily in this space here, extreme heat, but you can go through this list and see all types of health outcomes and impacts related to air pollution, severe weather, environmental degradation, changes in vector-borne diseases, and so forth. So these are the so what issues. I mean, I always find that public health is one of the so what issues that can resonate with the public, national security, infrastructure damage, and so forth. We as climate scientists have to talk about these things from a reference point that people understand and not sound like climate scientists talking about trend lines and sensitivity studies and all of that kind of thing. So, I'm often called to Washington to testify before Congress or advise the White House on these issues. So this is a picture of me in 2019 testifying before the House Science Committee. And I told them at that time, the extremes are becoming more extreme, as I showed you, for example, with that heat graphic. And that's what people feel. That's what impacts people's lives. It's not these shifts in averages, it's the extreme events. And so a question that comes up all the time in these circles is today's weather already feeling the DNA of climate change? In other words, is the fingerprint of climate change already in today's heat waves, in today's hurricanes and floods? And the answer to that is yes. I co-authored this report. This is a report of the National Academy of Sciences, which I actually also happen to be a member of. I was elected to the National Academies in 2021. And we reported that we're seeing increases in the frequency, intensity, and duration of some weather events. What we found, and this is sort of a interesting little analogy that we used when we were on Capitol Hill, is that you can bake a cookie and slightly change all the ingredients, the so-called natural variability, if you will, of the cookie or the weather event, but the baking surface and oven temperature is fundamentally changing. And so even if you tinker around with different ingredients, you'll get a slightly different cookie, but it's going to also have the influence of that background baking surface and oven temperature. So this is how we sort of assess this aspect of climate science, which we call attribution. And so we know from this report that there are certain weather events today that have very strong attribution signals. For example, reduction in extreme cold events, increase in the intensity and frequency of heat waves, increase in the intensity of rainstorms, increase in the frequency of drought, and some aspects of intensity change associated with hurricanes. If you read that report, those are the areas where we have stronger evidence that there is a DNA connection between climate change and our weather happening right now today. We are less conclusive on, for example, the link between climate change and tornadoes, although people try to make those links. And we think we're starting to emerge in that area, but the scientific literature isn't conclusive. So if you hear anyone talking about, oh yeah, we're getting more tornadoes because of climate change, I can't support that in the scientific literature right now. So in some of my own research at the University of Georgia, I use this framework of exposure, sensitivity, and adaptive capacity. Now, this is a graphic, and again, it's very academic-y. I actually, in some ways, don't like it, but it's included in a paper that we did recently on compound events, COVID-19, and extreme weather events like hurricanes. We were really interested in, over the last 3 years, whether this sort of compound impact of more extreme hurricanes and tornadic storms and COVID, how did that impact communities? And so exposure is the event, the hurricane, the tornado, the flood. Sensitivity is how sensitive people are. And then adaptive capacity, from this framework at least, is how able are people to recover from those events. So this is a paper that another paper that me and a couple of colleagues published in 2021 in the journal Natural Hazards. And what we show here are these areas in brown, blue, and purple. These are the counties in the United States that we project to be most vulnerable to climate extremes by the year 2040. Now, you might be saying, oh, look at that. Most of that map is yellow. So that means most of the US is not climate vulnerable. No, that's not what it means. We use a right skewed scale to really highlight those counties at greatest risk. So counties in yellow aren't necessarily not vulnerable. The counties that just show up in brown and blue are just particularly, those are the ones that we need to raise a red flag and get some mitigation and adaptation strategies in there immediately. So you see coastal counties, urban counties, and so forth, counties in the desert Southwest, some counties in the Midwest, but they tend to be more urban, St. Louis and Chicago and so forth. So it really boils down to this sort of group of people when we calculate this vulnerability and sensitivity, which we use in these types of studies. Communities of color, children, older adults, and low-income communities, irrespective of their race, tend to drive much of that vulnerability, in addition to the types of storms or weather events that we're having. So this is all work that has evolved from some of the work of environmental justice advocates like Dr. Robert Bullard. We often talk about environmental justice from this idea that zip code is still a potent predictor of an individual's health and well-being. Individuals who physically live on the wrong sides of the track are subjected to elevated environmental health threats, and they're more than their fair share of preventable diseases. So environmental justice is this idea that you have a factory or a brown field or a toxic waste dump placed in some of these vulnerable communities. Well, I've extended this concept, and I talk about something in my writings. You can also find the book chapter or the opening chapter of a new book called The Black Agenda by Nina Apopku, where I discuss something that I call the weather climate gap, which is what I call a disproportionate sensitivity to extreme weather climate events and a delay in the ability to bounce back. So I want to show you some research that we've been doing on urban heat in Atlanta. So what you see here is the metropolitan Atlanta counties, and we took in weather satellite and data and research satellite data that can measure the surface temperature from space. And so we aggregated that over a 17-year period. So what you see here is the urban heat island of Atlanta. So the red and oranges, those are the hottest parts of the metropolitan Atlanta area based on those thermal analyses from satellites. These satellites behave just like those temperatures that you use to take our temperature during COVID. It's just in space, and it's sensing temperature of the surfaces. Well, one of the things that we found out when we broke those out by race and by areas that had been redlined over the past several decades is that communities of color are disproportionately living in the hottest part of those urban heat islands. And so we call these racialized urban heat islands. And those racialized urban heat islands are very much aligned with places that were redlined in the last century that became more industrialized, have less vegetation for cooling and so forth. So there's definitely a connection there. But we're not just sort of tracking what's happening. We've even proposed some very innovative engineering solutions to what I call engineer cities for thermal justice. We actually, working with some colleagues at Georgia Tech, Arizona State, North Carolina A&T, we have some plans and ideas, if we can get them funded by the Department of Energy or by the National Science Foundation, to do some radical engineering of cities to either repurpose that heat, redistribute it away from vulnerable communities, or reuse that heat that's being generated by the city itself. So at the end of the day, that extreme weather climate gap, I wish it was something more elegant and complex, but it's really driven by the wealth inequalities that we have in this country. This is median household wealth by race from 1983 to 2024, and projected, at least. And what you can clearly see is that gap, and that gap is what drives elevated sensitivity and reduced adaptive capacity. It's just that simple. And for that reason, why when we see a headline like this, it's not surprising to me. A year after Hurricane Harvey, the Houston Chronicle wrote that Houston's poorest neighborhoods are still recovering from that hurricane. That was from a few years ago. So that's where I'll stop. I think that this is a good opportunity now, perhaps for, I guess, both panelists to address questions. I don't know exactly how it's going to work, but I'm going to stop there and open it up if that's the appropriate next action. Thank you.
Perfect timing, Dr. Shepherd. Thank you so much for another illuminating presentation. I mean, unbelievable, and two very different populations, groups of individuals, but all with very similar impacts. So at this time, we will take questions from our audience, and our Jordan Curry Carter will assist us with that. So Jordan, can you help us out and open us up with one or two questions from our audience today? I think that's all we have time for.
Sure. And thank you both for your presentations. Jeannie, this first one will be for you. If you could share, if you've had a chance to read the article by Patrice Gaines about black snow in Southern Florida and bringing sugarcane, just wondering if you have any thoughts around that.
Well, I haven't read the article, but we know a whole lot about the sugar burning and its effect on the Black and brown communities in South Florida. It's really terrible. We don't have an office in that area, but we have been working with the Sierra Club to try and stop the sugarcane burning. It's a long story, but Brazil has shown that you can, instead of burning sugar, you can compost instead of actually burning the sugar. And it's really horrible to know is that when the wind is blowing in the direction towards the east, where the white community, the rich white community is, they will not allow the burning, but when the wind's blowing the other direction, they do allow the burning. There is a community there that has been organized to try and fight it, but just like, they don't have a lot of money, they are, they are getting health effects. But we have been involved, with other organizations to try and fight the sugarcane burning. But it's been a long struggle, and right now it's still happening. But yes, it's really horrible, and it really needs to stop. And it is causing more health problems for the community there. And yeah, it's just terrible. There was a lawsuit, but I don't know lawsuits in tier, and I don't know where that stands right now. Thanks for the question. I wish we had better.
Yeah, thank you, Jeannie. And Dr. Shepherd, this next one for you, just a question around what was the Senate response to your presentation in 2019?
Yeah, thank you. And I just dropped a little of that in the chat, but I'm in Washington pretty frequently, and I think there's a perception that there's still more political divisiveness on some of these issues than there are. I found pretty reasonable queries. This was kind of right after the big hurricanes of Harvey and Michael and some of the flooding and heat waves that had happened in the last couple of years. I find that many of the folks on either side of the aisle are responding to their constituents. Public perspectives and opinions are shifting. I would invite all of you, if you're not familiar with it, to take a look at the Yale Climate Communication 6 Americas study. It's available on their website. They survey the American population every year with a host of questions related to climate change. And what you'll find is that America breaks out into 6 areas, 6 groups. And this group that they call dismissive has been steadily declining now, somewhere between 7 and 9%. So again, very small percentage. They just tend to be the loudest on Twitter, or that uncle at your Thanksgiving dinner who claims he knows what he's talking about because he YouTubed or Googled something. So I think we're seeing less of that. And I see that in my interactions with political entities on both sides of the aisle. And I think we're seeing that because even in the Infrastructure Act or the Inflation Reduction Act, there's a lot of climate action in those bills that were passed in a bipartisan way.
Can I make one quick comment before we, because I think it's really important. You know, in terms of the last question about the sugar cane burning, you know, we are a grassroots organization, and so we are very grounded in the communities that we work with. And we have been doing work around heat and climate change, but we deal with the whole person. And right now, that Florida passed a horrible anti-immigrant bill. And why is that relevant? Well, we have to shift our work right now. We've been working on heat and pesticides and health, but right now what's most important on people's minds is their fear of being deported, being separated from their families, being locked up. So it's really terrible that we have to kind of shift our work right now. Right now, heat and health is not on people's radar screens. What's on their radar screens right now is not being racially profiled, not being picked up by immigration authorities, not being separated from their families, not being locked up. So that's the reality on the ground, is that we are dealing with you know, the whole person, and right now they're being attacked on many different fronts. So yeah, thanks. Sorry to interrupt like that.
Thank you for that, Jeannie, and thank you for that, Dr. Shepherd. I think you both have just given us a wealth of information to go back and digest. It's just been so much. And Jeannie, your information, we will drop that you just shared about the bill in Florida. You all are dealing with so much there with your governor. And then Dr. Shepherd shared the Global Warning 6 Americas study. The consortium is a part of that Yale climate group, so we actively participate. Dr. Ed Maybach from our group is actively tied to that. So thank you for throwing that out there, Dr. Shepherd. We really appreciate it. And we, again, appreciate both of the presentations. They were excellent. And we know that this discussion could go on and on. It was just wonderful, but we have to wrap up so that we end on time. We'd like to thank both of our speakers for participating in this series. We thank you, our audience. We hope you found it useful. I know I did. And as a reminder, we have a survey for you to complete. So we will drop that evaluation in the chat. Our topic for next month is emergency preparedness, which ties right into this discussion. That's scheduled for Friday, June 12th. We also wanted to remind you, and if Clarissa could put that slide up for us, we do offer CME for these presentations, for these webinars. And so the information on how to collect your CME will be up on the screen, so you can scan the QR code. And today's activity code for this webinar is 12878. So once you go through that process, you'll use activity code 12878. We will also have the webinars up and available on our screen, and you can go watch the recordings and claim your CME credit there. Again, we appreciate all of you for being here. We thank our speakers, Dr. Marshall Shepherd and Jeannie Economos, and we thank you all. Please complete the survey evaluation, as well as if you would like to claim CME credit, please do so. And we'd like to conclude our session and ask you to have a great day, a wonderful weekend, and an awesome Mother's Day.